I'm Dr. Raymond Douglas, Beverly Hills, California, and here in Los Angeles. Today joined with Dr. John Cabin. He is a facial plastic surgeon and has specialized training in pain management, especially migrainous pain. So our subject today is dealing with orbital pain, chronic pain, usually associated with thyroid eye disease. And I often encounter patients where this can be a huge and significant complaint. In fact, I've had many patients who have actually been on narcotics for long-term use and just couldn't break this cycle. Well, there is a treatment now, and Dr. Cabin and I are going to speak a little bit about it, and that can be used with and be done with Botox and also a surgical treatment to actually improve that pain. So two great options that I think most people don't know about and most practitioners don't know about in the country. So thank you so much, Jonathan.
Yeah, thank you for having me, Dr. Douglas.
So orbital pain in thyroid eye disease is kind of unique because people feel it as a deep pressure or pain behind the eye. And when I often ask people to locate that pain, they always try to point behind their eye, but end up about at the temple in this location or right about at the brow. And this is where two nerves emerge, and a lot of times we've been very successful in treating this with Botox and actually decreasing probably the muscle spasm around these nerves. And Dr. Cabin is specifically trained in doing this in a variety of other locations. And so tell me, Dr. Cabin, how does this overlap with how you treat patients for migraine pain, and what are some of the tricks that you've used?
Sure, yeah, I'm happy to talk about that. I think there's a ton of overlap, and again, underlying a lot of the migraine treatment that I do is the idea that there are these nerves, the two that you spoke about in the temple area, and others around the head and neck that actually send signals, faulty signals into the brain to trigger a migraine. So the brain is actually, inside the brain is where the pain is occurring, but the trigger, the domino effect, starts outside the brain. And so by targeting these sensory triggers, these anatomical triggers, and deactivating them a bit and desensitizing them a bit, you can prevent the trigger of the migraine. I think, Dr. Douglas, you mentioned Botox, which is an incredible treatment. It's been around for a bit, actually FDA approved for migraines in a very specific way. And the idea is that when you inject Botox in the area of these trigger nerves, after doing an evaluation of the patient and figuring out where these triggers are, you're decompressing muscle around the nerve that may actually be causing the nerve to be irritated. In addition, there is some evidence to suggest, and I actually believe that the Botox can work on the nerve itself to alter the nerve transmission so that it's not firing as much. That's not as proven in the literature, but there is some data that suggests that happens. And again, it works in areas where there isn't a lot of muscle, and so you have to assume that it's doing something else. And then, of course, the other side of the coin is surgery. Again, trying to do the same thing that Botox does, but instead of using a chemical, you're going in and you're actually decompressing the nerve, releasing it from the structures around it, like muscle and bone and cartilage, potentially fascia, arteries that may be irritating it. And that's another treatment, again, we use in the temple, as you know, and other areas around the head and neck.
Yeah, and so many patients ask, how safe is Botox? And I'll give my answer first and let you, agree or disagree.
Yeah,
but
for sure.
Botox is extremely safe. It's probably safer than an aspirin. Botox given in the temple is about 10 units on both sides, and then even in the corrugator about 10 units. So it's a very small dose. You won't look different or weird. It's actually quite painless to give in those particular areas if given correctly. And there's really very little downside. No medicine is obviously perfect or without side effects. But considering the magnitude of the debilitating problem that some people can face, and that all the thyroid experts always say that pain is not associated with thyroid eye disease, but it really is. The surgical approach was done as part of a decompression, at least in my hands. But tell me a little bit about what you feel the safety of Botox is in your patients.
Sure, yeah, I think that's a great question. A lot of people are obviously concerned with safety, and it's important that patients understand that, as Dr. Douglas mentioned, this is an incredibly safe treatment. In fact, doses, tens, hundreds of times the dose that we give for migraine or cosmetic purposes are used in children that have certain muscular issues, and there's never been any serious side effects from that. And again, I do believe there are certain things that are over the counter, like aspirin, that could be more dangerous potentially than injections of Botox. In terms of other issues like pain and discomfort, you know, you and I both use really small needles and a certain technique that requires less actual pokes with the needle, and an injection technique that really minimizes, if not eliminates, any pain associated with the needle. People are typically really surprised at how painless it is after being somewhat worried about the needle aspect of it.
Yeah, many of my patients don't even know that we've finished the injection.
Yeah.
So if you want a relatively easy but relatively painless solution to orbital pain, which is really chronic and often not treated well with ibuprofen or Tylenol or even narcotic medicines, it may be something to think about for Botox. And in addition, for migraine-associated pain, Dr. Cabin has outlined Botox, but also that decompressing some of these nerves for really chronic conditions may be worthwhile. Thank you so much.
Yeah, thank you. I appreciate it.